Hello, I'm Shireen Jayne, OBGYN from Madison Medical. So the reason I became a physician was really following my father's footsteps. My mom's a nurse, my dad's a doctor. It was the best profession I could have imagined. I was initially in public health and realized that I really wanted to actually take care of the patients and not just learn about the diseases, and went to medical school and on a primary care track and ended up loving surgery and procedures. I think I have my dad's surgical ability and knack for surgery, but then I have my natural instincts to be a primary care provider. So OBGYN was kind of the perfect fit. When you're an OBGYN provider, these women really connect with you and they are so motivated to really take care of themselves. They listen to what you have to offer. They don't just want to prevent illness and hospitalization. They really want to be a better, healthier, well person. They're interested in preventive medicine, and that, with my osteopathic background, kind of met perfectly with the adrenaline, the procedures, and the primary care. I've been practicing for 24 years, and I think my practice has really evolved. I am very comfortable and confident at this point in my career. I love surgery. I pride myself on being able to tackle some of the most difficult, minimally invasive surgeries with very, very low complication rates. I really am, safety is number one, and positive outcomes are also my main goal. I think my practice is really geared toward the older women who are having difficulties with menopause or difficulties with abnormal bleeding. And I have a very simple, minimalistic, non-invasive approach. And we do a lot of our procedures in our office, which saves costs, makes it more convenient, it's less intimidating, and we're really focused on a lot of the women, even after having babies, coming in and taking care of them. Well, a lot of the surgeries that we do are very complicated. They're not minor surgeries, especially women who come in for hysterectomies or, have a big ovarian cyst. We always team up as a team with our patients. They know exactly what to expect, how to recover. There's pictures drawn, lots of information so that they know exactly what is going to happen. I also believe that the more you have a patient prepared for surgery and the more that they have a really positive outlook on what to expect afterward, the recoveries are so much better. We have better outcomes. They really heal better. They move more, which is great for recovery, and positive mind is positive results. And in our group and at Madison Medical, the reason I switched over from a corporate practice to Madison Medical is because the patient-physician relationship is so much more intact. We have a direct link to each other. They can call my office and speak to me directly. We MyChart message each other directly, as opposed to a lot of other corporate medicine places. You have to go through a triage nursing system, and that nurse may not belong to your provider. And there's a disconnect there. And it's nice to kind of always have a direct connection to your patients. And that's one of the reasons I love private practice with Madison Medical. So historically, women have been just trained to kind of deal with things and really suffer with hot flashes, suffer with abnormal bleeding. And there's so many women who come in and tell me they've been put off by other providers, that this is normal, it'll get better, it'll go away. And I am looking for those patients to kind of take charge of their life and come and find me, because you shouldn't have to suffer. I want patients who are actively involved in making their quality of life better and taking initiative to come and talk to me about these issues. If a patient comes to me with all of these complaints, I'm not going to brush them off And I think that we together as a team will tackle them and make them 100% better.